Coming up today, the youngest man ever to be diagnosed with breast cancer, what he felt before seeking help, plus his mission to reach men like him. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. If a woman feels a lump on her chest, breast, or armpit, we all know that she should get a mammogram. But what happens when a boy, still in high school, finds a lump? Janine Kiesling introduces us to a young man who found out that he had breast cancer years after feeling something was wrong.
When Bret Miller was just 17 years old, he found a lump in his chest. It was during a routine physical for high school football, and like most men, he didn't think much of it. When he asked his doctor, he was told it was just a calcium buildup. He, nor his doctor, suspected breast cancer.
Being a male, there was just not a lot of information and awareness for men.
But as the years went on, Bret began experiencing strange symptoms. Still, he wasn't concerned.
I did have a discharge from my right nipple that I really didn't tell to anybody. So had I known that was a symptom of breast cancer and stuff, I probably would have acted on it a little bit more.
Finally, when Bret was 24 years old, he decided to take action. He asked his doctor for a breast exam. His doctor then ordered an ultrasound and mammogram at a woman's clinic. The diagnosis came in. Bret had breast cancer.
I was in shock. I thought that I was getting punked. I actually called my dad to let him know. And I said, hey, please don't tell Mom.
But 5 minutes later, Bret's mom, Peggy, was calling. And the next day, they were back in the doctor's office looking for answers.
I would expect this knowledge to happen with my daughter. But to have a son with breast cancer at that age, all you can say is, oh my God.
Although Peggy's family had a long history of breast cancer, it was always among women. Bret's diagnosis was a first. He became the youngest man ever diagnosed with breast cancer, and doctors feared after 7 years the cancer had likely spread throughout his body. Peggy shared the news with her great aunt, a nun, who was visiting the Pope at the time. Upon hearing the news, she asked the Pope to pray for Bret. His response was powerful.
Your great nephew was put on this earth for a purpose, and this is his purpose, to get this message out to all mankind that breast cancer does not discriminate.
That big?
Yeah.
Yeah.
That message would become Bret's mission. In 2013, he founded the Bret Miller 1T Foundation to raise awareness for male breast cancer and to help other men who might be facing the same struggles he did.
It's okay to not be okay. There's a lot of mental with it.
And it can be your dad, your brother, your uncle.
Bret has traveled across the country speaking at events and encouraging men to take charge of their health.
Just being more proactive about your health. If you find a lump, don't brush it off. Go to the doctor. If one doctor tells you, hey, it's nothing, don't worry about it, but you don't feel comfortable with it, go to another doctor.
Bret's diagnosis and the journey that followed were not easy, but today he continues to be a voice for those who may feel alone.
It is okay to be diagnosed with breast cancer. Things happen, life happens and stuff. What you do with that is what is going to define you.
We are so happy to have Bret Miller and his mom, Peggy, with us here this morning. Welcome to you both.
Thank you for having us.
So good to have you, Peggy.
Absolutely.
What stood out the most to me is you said, don't tell Mom, and 5 minutes later that call came right in. You weren't going to stop that.
Well, I turned around, my husband's face was red, and I knew something desperately was wrong. The worst was real.
Typical mom. You're not going to keep Mom away.
Yeah, but it ultimately was the best thing because instead of that 3 to 5 days like I was told from the doctor, we were in his office the next day.
Absolutely. And we also have Dr. Shane Steckline with us. He's a radiation oncologist here at the health system specializing in the treatment of breast cancer. Always good to have you here with us.
Thank you for having me.
So, Bret, Peggy, this is a big week for you all because you are hosting a conference on male breast cancer. It is the 12th year for this conference, but this year you will be in person for the first time since the pandemic, I understand. What do you have planned?
So we're greeting everybody with a big mama burger party on Thursday.
Yes.
Provided by her. It's age-old tradition. It was what I had right after my surgery.
We invited all the nurses and the doctors over for a big party. We grew up on it and had all the football teams over and stuff. So it's like smash style burgers on a 100-year-old cast iron griddle from her dad. So seasoned very well. So we'll have everybody over on Thursday, and then on Friday is a long day of speakers. We had about 20 speakers.
19
or 20
over
speakers.
22 speakers.
On Friday, provided meals and stuff, and then kind of for the weekend, let everybody that's in town kind of enjoy Kansas City, because a lot of guys haven't met other survivors and or been to Kansas City, so we wanted to try to give them like a weekend getaway to enjoy the rest of the city.
It's going to be a great time to be all together again
absolutely.
and share stories. What kind of stories, concerns do you hear from other men with breast cancer when you all get together?
They feel that there's nobody else with them and stuff, so many of the guys have only met other men through social media. When we do our men's only monthly meetings, that's pretty much the only time that they've ever met the other men. So they haven't met other men in person that have been diagnosed. So being able to physically meet somebody and stuff, a lot of them are looking forward to that and stuff. But we just ultimately let them know, hey, you're not alone. We're all here for you.
Yeah, social media, great. It can be great, but
yes.
But in person, even better. Peggy, any stories that have stood out to you?
Well, the last one was in person conference, was actually in Orlando, Florida. And the first thing the men were able to do is they all pulled up their shirts and compared their scars. Women can't do that, but men can. And it is exciting to know that they feel the same way. We women talk about things, men don't. But when they finally got together and be able to share what they've all been through, that's the most amazing part of bringing all of them together.
And those scars, like a badge of honor.
That's exactly what it is.
What a powerful moment. Bret, after your diagnosis, how much time before you ever had met another man with breast cancer?
Excuse me. It was actually quite some time. I mean, at least a year or so. I mean, I had heard that men got breast cancer, and the first time was Richard Roundtree. Was when he had an interview way back in early 2000. I think my mom was watching Entertainment Tonight, and it was on there, and he was speaking about it. He was diagnosed in like 93, 94, but didn't talk about it for about 4 or 5 years because he was afraid that he would not get any more work in Hollywood. So I heard about it early in 2000 and stuff, but even when I was, feeling that lump, I never thought anything. I was like, it's not going to happen to me. It's older men and everything.
And it sounded so rare.
And then, kind of came full circle in 2013 when I was on the Katie Couric show. I actually got to meet him in person.
Wow.
Before then I met some other ones and stuff, but it was really cool to kind of meet him and stuff. But, shortly after my diagnosis, I was able, I had the opportunity to be on different newscasts and newspapers and everything. And I had another male in the 60s within a month of my diagnosis call me being like, I'm kind of freaking out right now. How did you get through it? And I just had to kind of just talk to him and just be like, hey, it's okay. Yes, it's a scary thing. You got told you have breast cancer. You're a male. You don't think that it's physically possible, and everything. But, you're fine. There's treatments out there. If you caught it early, you'll be okay.
Yeah, these full circle moments that you never expected to be a part of. I want to go back to this because you were young. Let's talk about this 7-year gap from when you felt this lump. What compelled you to go and ask for that breast exam at 24?
Her and my dad. I'd been at my job that I was at for 23 years. I had been there for about 2 years. I started there when I was 15. But I had been there and had medical insurance for about 2 years, but I'd only gone for, the common cold or something else. And they'd asked me, they were like, when was the last time you actually had your physical? And I go, back when you guys took me before football, high school. Everybody was asked, well, why did it take so long? Well, my parents are self-employed, so insurance, we didn't have, after 18, I didn't have insurance. I was in college, so poor college kid, all the stereotypical stuff. But I didn't have anything that made me feel like I had to go to the doctor. Yes, I had that lump and everything. I didn't tell anybody for about 1.5 years or 2 before I was diagnosed, but I had that discharge. But that was only because I was told that it was a calcium buildup. It would dissipate and go away. And as a male, as a naive teenager and stuff, you want to believe that somebody that has gone through so much schooling and learning everything and smart as a doctor and everything, that what they're telling you is true. And 99% of the time, it is true. But medicine changes every second, every minute of the day. So I never fault any doctor for any misdiagnosis, because at what point is, who is thinking that a 17-year-old male in 2003, 2004 has breast cancer?
You wouldn't.
Because of the lump. Nobody would. So I would never fault him and everything. So it was just one of those things, like, I just kind of took, the advice of the doctor and just went with it. I was like, okay. And, but I did have that discharge and everything, and that's when they had asked, they were like, hey, do you still have that lump? And I go, well, yeah. I was like, but it's not bothering me, so I'm not doing anything about it.
Well, you finally did get it checked out.
Yep.
And you and your mom, Peggy, your big message, men have breasts too. It's right there on your shirts. Dr. Stecklein, when it comes to anatomy, what are some of the similarities, I guess, or differences between women's breasts and men's breasts?
So up until puberty, the breast and the mammary gland in men and women are indistinguishable. It's really when women go through puberty and start having menstrual cycles, those pulses of hormones, particularly estrogen, causes the milk duct tissue and the lobules to grow and fill that developing breast mound. In women, the breast tissue can extend almost up to the collarbone. It can go way back in the armpit. In men, in most cases, the breast tissue really is confined to the area just underneath the nipple and the areola, which is the pigmented area underneath the nipple. And so it's a much more confined, smaller focus of glandular tissue.
Give us some numbers and put it into perspective. How common is male breast cancer?
So we all know that about 1 in 8, and unfortunately now about 1 in 7 women will be diagnosed with breast cancer during her lifetime. In men, that number is somewhere between 1 in 800 and 1 in 1,000. Different estimates put it a little higher, a little bit lower, but in terms of all breast cancers that we see, about 1% of breast cancers happen in men.
What age would it normally present?
Late 60s or early 70s.
So this is very rare.
Bret's diagnosis is striking, and it goes back to his point that it should have been on the differential diagnosis, but it would be exceptionally uncommon to see that in a 17-year-old young man.
Does the treatment differ between men and women?
It can. So I'll start by saying that everything we know about breast cancer we've learned from clinical trials that were done in women, and we in most cases just extrapolate that to what to how we treat men. The two primary differences in how we treat male breast cancer, one is from the surgical perspective, because the breast tissue really is confined to that small area underneath the nipple and areola. The vast majority of men are treated with mastectomy. There are reports of using lumpectomy to treat men, but really mastectomy or complete removal of the breast tissue is the primary surgical management. Chemotherapy, radiation therapy are applied for the same reasons and in the same way that they are in women. Hormonal therapy is a little bit different, so the vast majority of male breast cancers are hormonally driven. In typical kind of post-menopausal women age group, we often will use a drug called an aromatase inhibitor to treat those patients. In men, even men in their 60s or 70s, their gonadal hormonal physiology is much more similar to a premenopausal woman, so we typically use a drug called tamoxifen in that setting.
Bret, after surgeons removed your lump, you went back for a mastectomy. They took your nipple, breast tissue, and some lymph nodes. Did it take time to adjust to your new body?
A little bit. We did the whole deep dive, Google dive and everything. We saw all the different photos, and that's kind of what freaked me out at first. Because the first picture, the only picture I really saw was like a Marine saluting, and he had, his chest was, concave and everything. So it was kind of, a little freaked out because I like going to the pool with friends. We do float trips, lake, and all of that. So I met with the plastic surgeon and tried to get some information on it. The first surgeon that took the lump out, I was going to be his first male who was ever going to perform the mastectomy on. So I was kind of like, what? And he was, no matter what, double mastectomy. So I was kind of like, respectfully, I'm going to get a second opinion. Second doctor kind of said the same thing, but he was like, we can do this, the right side first, and then we can come back. And I was like, oh, that's good to know. And it was that second doctor, in talking to him, that he said that he had performed other surgeries on other men, and that if I was willing to share my story, because all these other men did the surgeries and went back to work like nothing ever happened, don't talk about it, that he felt that I could put a face to male breast cancer. So I was like, okay, I kind of took that in, still met with that plastic surgeon. And he was like, I've never performed a reconstructive for a male, but I'm not saying I can't. He's one of the top breast surgeons in the area. But it was you'd be the first one, kind of felt like I was going to be the test subject, didn't really feel like doing it. And it was at that point that I came to terms with it. And I was like, you know what? I'm not doing any reconstructive. The scar is who I am now. It's how I can tell my story. It's how I can prove that when people go, I have breast cancer and stuff, they go, no, that's not possible. They kind of look at you and kind of laugh and be like, that's not true and stuff. And then I'm able to lift up my shirt and I show the scar and I go, well, then what's this? You know, I'm not trying to like embarrass them and make them feel stupid and stuff, but you know, myself, when I tell somebody I have breast cancer and stuff, they kind of look at you like, that's not possible. Well, it is. So it wasn't until, you know, meeting with all those doctors that I decided that this is my story now and this is how I'm going to take it. So it took a little bit to, you know, get used to it, but at some point I was just like, you know what, I'm winking at everybody now, having a little fun. So I found that humor was a big part of everything.
And what a teaching opportunity.
Yes.
What treatments came after surgery?
So I opted to do, they did the Oncotype DX test on me, and I was the second male that they did the test on. And based on comparing it to all the data and stuff, they said that I had a 22% chance of cancer of some sort coming back over a 10-year period. But study shows that if I did 4 rounds of chemotherapy followed by tamoxifen, that those chances could be decreased by 10%. And I was like, well, I'm young, I feel fine. Like, I honestly don't feel sick at any point. Like, yes, I got diagnosed with cancer, but I didn't feel any of that. So I was like, let's do whatever I can to reduce that down to close to 0. So I did 4 rounds of chemotherapy, and then they started me on tamoxifen. I was on tamoxifen for about a month. I had all the side effects, the hot flashes, the mood swings, all of that. And I was like, Doc, I can't do this. Like, it was like, I remember it was a nice spring night and I was working downtown at the bar and I had to like run outside because it got so hot, but it was gorgeous outside. And I was like, I don't know what this is. So I changed it. They took me off tamoxifen and put me on a Arimidex, anastrozole Arimidex, either one of those names. So did that for about 5 years. I don't feel like I ever had any side effects from that. Did that for 5 years, and yeah, this upcoming Monday, the 28th, I'll be 15 years diagnosed.
Wow. Dr. Stecklein, I want to talk fertility, because it can be a challenge when it comes to cancer. What do oncologists need to consider when you have a younger male patient? What are those conversations like?
So anytime we use chemotherapy, radiation therapy, particularly pelvic radiation therapy, that can adversely impact or even completely destroy a patient's fertility. In Bret's case, the major things that would have contributed to impaired fertility would be chemotherapy. And then tamoxifen doesn't directly impact fertility in men. There are actually some studies showing that it can increase sperm quality and sperm counts. Bret didn't talk about it. I imagine you probably got a shot as well when you were taking Arimidex. Did you ever get injections?
No.
Okay. So it wouldn't have been uncommon for somebody on an aromatase inhibitor to also get a shot that in women we call ovarian suppression. We also use those shots in treating men with prostate cancer. And it basically tells the brain to tell the testicles to stop producing testosterone. And so obviously that would impair fertility as well. Both of those, especially in really young patients, should be reversible processes, but it can take a long time for fertility to recover after those treatments.
How did you navigate your fertility concerns?
At the beginning, because all the information's coming at you like a freight train, it was not even a question on my radar. But my nurse navigators, and then of course my mom asking the question because she wanted grandkids and everything. Awkward conversation to have your mom have, but they recommended to bank sperm just in the off chance that the chemo did any of the drugs or anything did anything. So I did. I had it, I think, banked for about 10 years, but luckily I never had to use it. I've got 2 gorgeous babies at home.
Peggy got her grandchildren.
Yes, I did.
Tell us about them.
Yes, Miss Riley Sue, who is our next advocate for male breast cancer. She tells everybody, she's just 5 years old, if you take pink and blue and put them together, they become purple, which is my favorite color. And my daddy is a breast cancer survivor. So make sure you check your breast every month.
I love that. You're starting them young to advocate.
Yes.
I think that's fantastic. What other advice do you give young men that you have met? I mean, you're out there spreading the word. What are you sharing with them?
The biggest thing is be your own advocate. You're your best advocate. Like, know your body. So do your breast self exams. You know, you asked about, I had to ask my doctor for a breast exam. Well, yeah, because I went for a normal physical, and he was pretty much out the door. And then that's when I said, hey, doc, I've had this lump under my right nipple for some time. I'd be in trouble if I didn't get asked or, get it looked at and stuff. So we have to ask our doctors for breast exams because they don't perform it in a physical. When I went back and asked them afterwards, like, what would you consider putting that into your normal routine physical? I got told, well, less than 1%. Statistically, it's not really there. It's got to be hereditary. All these other things, and I'm like, it's 30 seconds to a minute of your time to do a quick pat down on a male's chest to do it, and it was kind of off-putting being told that it's not worth his time. So, I mean, needless to say, I left that doctor and found somebody else. But you're your own best advocate. If you find a lump, go to the doctor. If the doctor tells you something different, go to another doctor.
Keep asking questions.
Yeah, keep asking questions. But treatments have come so far that don't be afraid to get that diagnosis. Like, yes, it's going to suck, but you can overcome it. And there are others out here that have, and we're here as a support system for you.
Please send in your questions if you have any right now. You can use the chat on YouTube or Facebook. You can email the Medical News Network. All of that information is there on your screen. Peggy, of course, you have done so much to raise awareness. You guys even have your own foundation and website. Tell us all about it.
Yes, it's our actual website shares other stories from other males across the globe, and that's malebreastcancerhappens.org. And then we also have, from that page, you can go to the breastselfexams.org website, and that is a learning where there are actually digital cards that you can download, and it's for men and women, and we have that in over 25 different languages. So you can share those with anyone that might not speak our English language, but it's available, and we get traffic on that website 10 to 12,000 a month because people are finding it when they Google breast self-exams, and they're able to pull that up.
And you actually demonstrate how to give those self-exams.
Yep, I'm the model. Yeah.
You're the model.
The beautiful model. So, yeah, it was good educational to do that because honestly, before doing those videos, I didn't know the proper way to do it. So.
Well, thank you for demonstrating. You're right, because some people don't know how to do it. So there it is. You can go to those websites and check that out. And there's a stereotype. We know that. It turns out to be true in many cases that men are not very proactive when it comes to their health. We've heard this before. Dr. Stecklein knows it can be true. They may not be going to their primary doctor or even have a primary doctor. What's your message to men who maybe don't prioritize their health or have yet to prioritize their health?
That we need to be better about our health. I know a lot have, parents and dads and grandparents and everything, and that older generation's always that, throw some dirt on it, walk it off, you'll be fine and stuff. But honestly, you need to get to the doctor. You need to have your routine yearly exams. And then if you, like you said, do your breast exams, and if you feel a lump, ask that doctor to perform that breast exam in it. But know your body. Anything feels off, get to the doctor.
Peggy, what's your message?
Totally. Knowledge is power. If you find something, do something about it. Get to a doctor. And I have 3 sons and 1 daughter. My sons never go to a doctor unless they're really, really sick. So men, treat yourself nice and get to a doctor and get some answers.
And
don't
listen
just
to your
live with
mother.
it. Yes.
Listen to your mother. It's so simple, right? Dr. Stecklein, what's your message?
I think that early detection is critically important, and that's true for breast cancer in both women and men. That's true for colorectal cancer, which we're also seeing an increase in young patients. So seeing your healthcare provider, seeing your physician, getting recommended screening tests for cancer, for cardiovascular disease, for all of that, that's the best way to stay healthy.
All right, I want to get to some community questions if we can this morning. And Andrew wants to know, how much do genetics play a role in male breast cancer?
So if we look in women, about 5 to 7% of all breast cancers are associated with inherited mutations in genes that we know put patients at risk for developing breast cancer. That number is considerably higher in men. It can be up to about 40% of male breast cancers are in individuals who have inherited a predisposing genetic mutation. BRCA2 is the most common gene that we associate with male breast cancer, but there are a handful of others. And then there's some rare syndromes, including something called Klinefelter syndrome that we know puts patients at risk for male breast cancer.
Jeremy wants to know, what does a male mammogram look like?
Not much different than a female mammogram. You can imagine there's typically less tissue, but the principle is the same, that you try and get all of the breast tissue into the imaging device. We typically take the same views, and our breast radiologists are absolutely qualified to read male mammograms just like they are mammograms in women.
Lynn has a question. Do men who develop breast cancer have a higher likelihood of also having liver issues? Is that something you've heard?
So it's not so much that, it's probably a chicken and egg situation here. We know that patients who have liver disease often have imbalances in sex hormones. And so patients with advanced liver disease often have lower levels of androgens or testosterone and higher levels of estrogen. And so that can put them at higher risk for developing breast cancer. So it's not so much that the breast cancer caused the liver disease. It's more likely that some underlying liver process increased their circulating levels of estrogen and put them at higher risk for developing breast cancer.
Tony wants to know, when did you get your tattoo?
It would have been, I started it in November of 2010 and I finished it a couple months into 2011, so
very cool.
Took a couple stages.
Becca wants to know what stage your cancer was at.
So technically, medically, it was DCIS, so stage 0. I was lucky enough to catch it early, quote unquote, for 7 years and everything. But yes, I got extremely lucky. Not all cases are the same, so just be adamant about your health. Early detection does save lives. Don't let the time fool you and everything, but yes, just be on top of your health.
Last question. Stuart wants to know, if estrogen fuels breast cancer in women, does testosterone fuel it in men?
No. Very legitimate question. We know that testosterone fuels prostate cancer, but actually testosterone likely has a protective effect in breast cancer. Testosterone in the body can get turned into estrogen, and that's where even men have low levels of circulating estrogen, progesterone. Women have low levels of circulating testosterone, and so we tend to put those hormones in buckets, but we all have different levels of all of those hormones. But even in men, it tends to be an estrogen-driven disease.
Such a great conversation today. Dr. Stecklein, what do you think the biggest takeaway is?
I'm going to echo Bret's message, and that's be your own advocate. If something doesn't seem right, it's probably not, and don't take no for an answer.
All right. Ms. Peggy, what's the biggest takeaway today?
Well, one thing that some of the men have brought to us too is not always was the lump right in their breast. It can be from here down to underneath your rib cage is what we've been told. And they've found lumps there that were actually breast cancer, and in later stages because they never got it checked.
So really know your body. Really check and ask lots of questions. Mm-hmm. All right, Bret, what's the big takeaway from your story?
I'd say the simplest thing is that men have breasts too, and just perform your breast exams, and just be your best advocate. That's really it. I mean,
thank you so much for sharing your story. This has been so great. Were you two
pleasure.
always close before this happened?
Absolutely, yes. Out of the 3 boys, he's been my closest ally.
This is it's just fun to see what you two have done, and we really appreciate your sharing your story with us.
My pleasure. Thank you for having us.
All right, Dr. Stecklein, great to have you as always. Thank you so much.
It's great to be here. Thanks.
Thanks to our viewers as well. Have a great one, and we'll see you back here tomorrow. He woke up in the hospital, unsure why he was even there. Now the mayor of Overland Park, Kansas, is giving thanks to the many specialists who helped save him. I'm Jessica Lovell on the next Open Mics with Dr. Stites. From car wreck to rehab and the surgeries in between. See how many hands it takes to heal a complex trauma. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.